on the muscles of the brachium. If you've cut through and cleared away the pectoralis group so that you can see the medial surface of the brachium, and cleared away the Clitobrachialis on the cranial surface and the fascia that sits over the lateral surface, you'll be able to see all the muscles of the brachium. And just a quick recap, here are our deltoids, chromodeltoid and scapulodeltoid, which has been bisected to see the teres minor and the infraspinatus. And then the three heads of the triceps, the most obvious long head on the caudal edge of the brachium, then the lateral head, and beneath that, the medial head of the triceps, and technically it would be the medial head of the triceps brachii. So on triceps and biceps, we use brachii as an adjective because they're three heads or two heads on the arm. Speaking of the biceps brachii, that's underneath the pectoral fibers on the medial, craniomedial surface of the humerus, which is right here where my scissors are pointed. And the pectoralis group on the cat inserts along the shaft of the humerus lateral to the biceps brachii. And it separates the biceps brachii from another elbow flexor on the craniolateral side of the humerus, and that is the brachialis. So the brachialis lateral to the pectoralis insertion, and the biceps brachii medial to the pectoralis insertion, both go down to insert on the forearm, on the ulna and the radius, and flex the elbow. Now also on this medial side of the humerus is a little muscle that comes from the coracoid and goes right across to the proximal humerus. And this is usually a darker muscle in here. It's called the Coracobrachialis. So if you're looking for the Coracobrachialis, you really have to move the pectoralis out of the way so that you can see up to the origin, or at least one of the origins of the biceps brachii. And you'll see the Coracobrachialis going right across the shoulder joint there. Another smallish muscle that you can see on the lateral side is a little triangular muscle that goes from the distal humerus to the ulna, proximal ulna, and it's a triangle right inside where my scissors are marking. That's the anconius. So the anconius is another one of the extensors along with the triceps brachii. Now, as you identify the muscles of the brachium and you're ready to move out onto the anabrachium, you'll need to start clearing away the anabrachial fascia to expose the extensor muscles and also the flexor muscles. And in order to identify the extensors and the flexors, you need to skin or remove the hide all the way up about halfway out onto the paw. And on the flexor side, that often means cutting through some pretty tough fascia around the pads of the paw or the palm, so that you can peel that back and see where the insertions are. So origins and locations for the anabrachial muscles are a good start, but identifying the anabrachial muscles require that you follow the tendons across the wrist. So you have to cut through or tear through the retinaculum. And when you do that, then you can kind of pull up on the tendons of the muscle and follow those out onto the digits, because several of these muscles are going to be identified by which digits they insert on. And so read that description carefully. For you folks in 121, you really only have to identify the most superficial of the muscles on both the extensor surface and the flexor surface. For 381, you have to identify all of them. So make sure that you start working those apart once you get down through the anabrachial fascia. And you can kind of pick at that fascia to start liberating some of these and use their tendons to start pulling them apart. And it's a chore. It's a thick sheath. But once you start to get it separated, then you can see the tendons and you can start to pull up on the muscles carefully and follow those tendons in both directions to cut through the fascia and get the muscles to where you can separate them. Now, one of the muscles that people often tear off, the first and most superficial of these forearm muscles, is actually also an elbow flexor, and that's the Brachioradialis, which comes across from the distal humerus and runs out to the radius. And it runs along with this radial nerve. And so a lot of people think it's just a nerve and kind of destroy the muscle, but you can see the brownish muscle fibers running from the humerus out. And oftentimes when you're tearing away the anabrachial fascia, you'll pull that away also. So be careful for that up on the radial side of the forearm. And I was going to say something else, but I forgot. Okay, oh well. So anyways, a lot of the time spent on this week's stuff is going to be opening up that anabrachial fascia and starting to separate those muscles. And the hardest part is once you get them down to the retinaculum on both sides, you really have to pry at that connective tissue that runs across without cutting the tendons that are going out to different digits. And so once you start to find the edge of a muscle and can get into the fascia at the edge of that muscle, then just keep following that down to the wrist and cut that across the surface of the wrist so that you can see where those tendons are going underneath it. And so you'll do that probably 3 or 4 times on each side to get that going. Okay, go ahead and get started on that.